Like millions of other women, you've been prescribed an intermittent catheter to use when you empty your bladder. If you're new to this and you're feeling uncertain, that's totally normal. But don't worry, it will become a habit in no time. Whether it's your first time or you're already experienced, this video can help you find the approach that works best for you. The catheter you're using is the GentleCath Glide, a low-friction hydrophilic intermittent catheter. It comes with a water sachet, which makes lubricating your catheter easy. It also has a no-touch sleeve to help avoid contaminating the catheter, and a sticky dot, which allows you to conveniently attach the packet to the wall. If you're using a Coude tip, you'll notice a mark or raised fin at the end of your catheter. This is so you can see which way the tip is pointing. This will be explained in more detail later. Before you start, remember to wash your hands thoroughly. This is important because it can help reduce infections. Now it's time to get into the position you find most comfortable. You can use a hand sanitizer or wipe to clean your hands when you get to the toilet after positioning your wheelchair. Position yourself facing the toilet. Pull down your pants and slide forward so that you are lower in your chair. And position yourself with your hips up and forwards. If your catheter is too short or you're unable to get close enough to the toilet, you may want to use an extension tube or handheld urinal. You may want to use a mirror to help you see what you're doing. Make sure it's positioned at an angle that allows you to see your urethral opening clearly. You may also find a mirror that can be strapped to your leg useful. Your urethra is a separate opening located above your vagina. With one hand, spread your labia apart and lift it gently upwards. Your urethral opening should now be visible. With the other hand, gently clean from front to back in a single wipe, using an antiseptic wipe or a clean washcloth. Now you're ready to prepare your hydrophilic catheter. Make sure the water sachet is near the funnel end. You can either break the sterile water sachet by pressing the bright blue dot, or fold the pack along the dotted line marked on the sachet. Let the water run down to the tip end of the pack. The catheter should now be used within 1 to 2 minutes. Once you've broken the water sachet, open the pack by peeling the tabs apart at the bright blue end. Remove the catheter using the blue strip so you never touch the catheter directly. If you want, you can rehang the empty pack using the sticky dot. Now you're ready to insert your catheter. Slide the sleeve next to the funnel. With your legs spread wide, gently pull back the labia. Make sure you know exactly where the entrance to your urethra is before you begin. Use a mirror to check this. Don't prod with your catheter until you find the opening. Only begin once you feel ready to insert. When you are ready, grip your catheter using the sleeve. Now slowly and steadily insert the catheter into your urethra. Continue to insert the catheter slowly and steadily. If you're finding it hard to relax, here are some tips. You can try taking deep breaths or wiggling your toes, perfect if you're in a public place, as this is a quiet way to relax. Or you might want to distract yourself with something. In the 16th century, the English and Dutch used to toast someone's health by drinking urine. Once the urine starts coming out of your catheter, you know you've inserted it correctly. Push it in another inch, or 2 centimeters, to make sure both holes are in the bladder. That's the hard part done. Now simply let the urine flow out. To help push urine out of your bladder, you can try pressing on your abdomen with your free hand, or leaning forward. Once urine stops flowing, slowly remove the catheter. Stop if more urine starts to flow, until no more comes through. This is to make sure all the urine has emptied. Continue to remove the catheter. You may notice a slight suction effect as the catheter is removed. A small amount of urine may come out of the catheter once you've fully removed it. Pinching or folding the catheter will help prevent this and may minimize any suction effect. Place your catheter back in its packet. Now simply throw into the trash. Remember, your catheter is for one-time use only. Use a new one each time you empty your bladder. Remember to give your hands a good wash when you're done. Your healthcare professional should be consulted before performing intermittent catheterization, and you should work with them on the best technique for you. This video is meant only to help visualize the advice and directions given to you by your healthcare professional. Please consult the instructions for use document that accompanied the product before performing intermittent catheterization.